industry will produce thousands of jobs, but you need to have the right stuff to get hired. There's a big need for medical professionals, from surgical technicians to dental assistants. You can start a new career or switch to a new career in as little as 9 months. Here to explain, welcome Akili, Atkinson and Ada Garcia, career services advisors with the College of Healthcare Professions. Good morning. Let me start with this particular program. How it all got started were from physicians who said we have a need, and a need that's not being fulfilled, and so the way that people are trained here is really effective.
Yes, it actually started over 27 years ago through McGregor Clinical, and physicians started to get in, more involved because we were in the need of healthcare.
Yeah, so they want people to come through the door already knowing what to do, not having to train people what to do, and that's what this program does. All right, the other thing that's nice is that you have so many different things that are taking place in the health industry right now. How many times have you gone to the doctor's office? There's a doctor, but there's a bunch of other people around doing things too, right? Well, that's what this is about, that whole support services for those doctors there. So programs like dental assistant, diagnostic medical sonography, something you probably didn't even know existed, right? But so when someone comes through the doors, the first thing they need to do is decide what area they might be interested in.
Of course, they're coming through the doors thinking they want to get in the medical field, but they may not know what they want to do. So we talk to them a little bit about their personality. What do they like? Do they like the billing aspect of it? Do they want to do insurance, or do they actually want to be hands-on with patients? So first we have that conversation, give them a list of programs, and then talk to them about what program might work best for them.
Yeah, all right. For a lot of people, what stops them from walking in the door is they think, I can't afford it. You can help facilitate that as well.
Oh my goodness, yes, yes. This is a college, so of course we have multiple avenues for them to be able to afford this experience. And as you said, 9 months to up to 2 years, it's affordable for anybody to be able to go into the medical field.
Yeah, and I love that the testing fees are included in the cost of the program, so you're not worrying about that later on. Okay, and then while you're in school, we know that life can get in the way. You have support there as well to make sure that they can stay the course.
We provide multiple levels of support. So we have a student services group that gives them the support that they need on a weekly basis, touching base, how are your classes going? And then as career services advisors, we also start that conversation about what it's going to look like when you graduate. What is it going to be? Where are you going to go? And how are you going to support yourself after you finish school?
Yeah, because your goal is to graduate someone into a job.
Into a career.
Yeah, into a career.
We're starting into a career.
That makes a lot of sense. The career is kind of different from a job.
Yes.
All right. Even things like resume writing, all the extra things it takes to get that career started, right? Interviewing and dressing for success.
Yes, we do. We help them. We try to do as much as we can with them. We can do mock interviews one-on-one. Those helped a lot, and we help them with their resumes. Yeah.
Yeah. And one of the other things that's so important today that was not an option several years ago is that you can be in a classroom setting or campus setting, but you can also do this online.
Yes.
We love online. Yeah. We love online because for some people, life is a challenge right now, and they know they want to go to school, but they don't have the time in the day. They might work a full-time job.
Kids.
They have kids and a whole other life outside of trying to go to school. And the online allows them to create their own schedule with their program. And so doing that means that they can start on that career path, even with all of the challenges that they have.
Yeah, because you do it on your time there. The kind of person you're looking for and the kind of person that needs to work in this business is somebody who has compassion, empathy, interpersonal skills.
Everything. We want people that are excited about helping others. That from the time that you walk in the door of the doctor's office, that person that greets you and says, "How are you? What do you need? What kind of service do you need?" We need people that are energetic and excited about getting into the medical field.
And if you're not the most chirpy, generous, nice person, we still have medical coding and billing for you. So that we put you in the back office over there. But that is a part of the support system as well. I remember somebody else that we interviewed from the school, who'd graduated into a career. She said, I'm not one to draw blood. And there are people who love doing that. She wasn't one to do that. So this wasn't a way for her to be in the medical field, but she was doing the coding and the billing, and that was great for her. Yes. So all right, and then all the way through graduation, helping in job placement. That's important too.
Oh my goodness. And as most people know, when they first go out in the job market, you just don't know what you expect. And we in Career Services, we want to give them that extra boost.
Yeah.
So from the time that they're finishing their program, we're talking to them about what they're going to see, where they want to improve the skills that they already have, their communication.
To the point where they're actually doing it.
Yes, yes.
All right. To learn more about the College of Healthcare Professions, visit chcp.edu, chcp.edu, or call this number, 800-487-6728, 800-487-6728, whether you're just starting out or you want to switch to an entirely new career. We'll be right back.